So if you're seeing this video, you're probably looking at a report of findings packet. In that packet, you're going to see a lot of information that's pertinent to your case. Specifically, the first part is going to be your x-rays. Our clinics do x-rays. We don't touch a patient without x-rays. I want you to understand how to read this packet. On the picture on the left, you're going to see what the normal x-ray should look like. If you look at the picture on the right, that's going to be you or your spine. Usually the first picture is going to be the neck. The second picture is going to be the upper back. The third picture is going to be a side shot of the lower back. And then the last picture is typically a shot of the front. What I want you to notice is the color differences. The red is where you are. The green is where you should be. At the text box in the bottom, you're going to notice that we have listed the measurements that your spine is off. These numbers are important to us, but more important to you because it tells us exactly what's going on in the vectors and directions that your spine is misaligned. So there's no guesswork. We're not thinking and trying to figure out what's going on. We've got a measurement and we get a plan of attack to move forward. On the 5th page of the sheet, you're going to notice that we have measurements. Lots of charts and measurements. Yes, we're OCD about what we do in our clinic, but what's important is that we measure every segment so we know exactly which one we're going for and exactly which one we're trying to correct. As you finish that packet, you'll notice at the end that we have our care plan. The care plan can be all kinds of different things because we custom design them. This video is somewhat generic to help you understand it, but the care plan can be all different types of exercises, different types of traction, different types of things based on your condition, your spine, your goals, and where we're trying to get to in the future for you. It's important that we understand what we're doing on that care plan. You're going to notice the first part of the care plan is where we started care. The most important thing that we're going to list there is the adjustment. The adjustment is what you have traditionally known about a chiropractor. Unlocking the spine. It may include snaps, pops, clicks. It may include an instrument. It may include all kinds of different types of mobility to the spine. The idea here is to create pliability and mobility through the spine. If we can get it to be pliable and mobile, then we can change the shape. When we change the shape, we can get you back to clinical normal. Clinical normal makes you feel pain-free and you function better and you hit your goals. The second part of that is traction. Traction stretches the ligaments that holds the spine together. See, the average chiropractor, I said it, the average chiropractor is going to unlock the spine. What we're going to do one step further than that is we're going to stretch the ligaments so that we actually change the shape. And then right after that, we're going to strengthen the muscles to hold that together and concrete in the fix. That's important, concrete in the fix. So we call that the 1, 2, 3 punch. We're going to unlock the spine, stretch the ligaments, and strengthen the muscles, holding the position in the correct position. And at the end of our care plan, you're going to notice that we did corrective x-rays. I think it's very important that you feel better, but what's more important is that we get a measurement that shows that you're better, not that we just feel better. I like to have objective clinical measurements to understand that you feel better. On the back side of your care plan, you're going to notice payment structure. At the very top, you're going to see total cost of care. Please look at patient responsibility. That would be for you. You're responsible for that portion of your care. We have several different ways that you can pay depending on how you like to do that. There may be some discounts built in. On the last page that you're going to see, the very back sheet that we're giving you, is a picture diagram, lots of different pictures. It is just a diagram to help you understand what we're talking about with the different devices and the different uses of the machinery that we use in the clinic. This is the entire packet. If you have questions for us, please feel free to call the office, shoot us an email for any of the concerns that you have. We look forward to starting care with you, but more than that, I look forward to those second x-rays where we can see clinical changes and we achieve those goals. Thanks again, Dr. Matt Griswold.